Basically, we have about 30 million people impotent in the US. From those, we tried every single thing that we can, the pills, injections, everything possible. And from there, we have a very good percent of patients who don't respond to the pills, the injections, other devices. And finally, those are the patients who actually need a penile implant. And most of the time after prostate surgery, radical prostatectomies, patients who are diabetic, patients who have suffered vascular disease, all those patients are good candidates for penile implants. After actually trying all the different options, those patients really, they want an answer, they want a solution. And some of those patients really, they're really willing to go just to try actually anything to resolve the trouble. So those patients are the perfect candidate after trying all the options. And the patients will request, I hear about there is something else. And that's when I really, talk about the implants. I explain to them there's really a very simple surgery. It takes us about 45 minutes. We do it through a very small incision through the scrotal area. We were able to place the 3 pieces through that incision. And actually, really, after 6 weeks of doing the implant, those patients, I can start using them. The implant really gives the patient what is the most normal erection possible, really, after having a normal erection. And there's a very simple way to function. They pump it. We show them how to pump it after 6 weeks. The patients, 99.9, the first time they learn how to do it. And after that, they can use it. We encourage them to use it every day, as least to activate the implant every day in order for them to get the full expansion of the implant. So for 3 months, we ask them to do that, and they get used to. I give them the example, if you use your new shoes once a month, it's not going to do it. So you need to do it, you need to use them every day, so that way you get used to it. And most of the time, because we ask them, if you do this, you're going to get the full potential of the implant. So they said, doctor, if I do it twice a day, will that be okay? Yes, go ahead and do it, because that way we give you the whole full potential of the expansion. We have actually 3 types of implants. We have the rigid ones, we have the 2 pieces, and we have the 3 pieces. That's actually the one we use most of the time. We have a reservoir, we have the pump, and we have the cylinder. So when you pump it, actually water or fluid from the reservoir gets into the cylinders. Each of these cylinders goes into the penis. We have 2 chambers, the corpora cavernosa bodies, and each one fits perfect. We adjust it to the size of the penis. This is a pretty good size one, but usually we have all the sizes available when we do the implant. And the pump goes between the 2 testicles inside the scrotum, covered completely by skin. Nobody will notice. And actually, we do it through a very, very small incision. We probably use about an inch incision in the scrotal sac. That incision disappears completely. Nobody will notice, and the pump will be hiding. It will be very functional, and it's a cosmetic appearance, actually, where the patients, and nobody will notice the